If you've had runner's knee, you've probably experienced that foam rolling your quad or parts of your leg actually is helpful in regards to pain management. I'm going to show you some of the targeted soft tissue or myofascial release methods that we use in the office today for the quad. Now into myofascial release of the quad, there's many ways to do this, but in this case, with runner's knee, we want to work the quad closest to around the kneecap as we can. And for this, I'm going to place a broad contact. See the webbed contact I have? You can also do a thumb contact, some fingers, but for the most part, we want to make sure that we are getting into the areas where we feel any restrictions or gristliness or denser tissue within the quad. So I'm actually using my leg to press her leg backwards, because oftentimes patients don't want to do the knee bend for you, but this really helps get the tissues or the quad to pull past my hand or through my contact point. Now there is fascia, and there is fascia between muscles of the quad. The quad is obviously 4 muscles. That's what the definition of quad is. So I like to just kind of find between the areas too. There's different heads of the quad muscle there, so we kind of look and feel and see if we can get between those sections to make sure these areas are sliding well. There is one quad muscle which actually goes above the hip, and we can treat this from a sideline position as well, but we want to make sure especially those 2 joint muscles like the rectus femoris do slide amongst the other quad muscles. Now with this other type of quad myofascial release, we're going to use a lot more lotion and we're going to slide a lot more. And oftentimes we use this to treat the muscle directly or to try to separate the fascia or the top layer of the, kind of just below the skin. If you imagine chicken breast, how it has that slime on it, this is what we're working on with this type of technique. Do a lot of passes and do them really long stroking fashion here, so you might need to reapply some lotion or oil.